Should you get vaccinated with active TB disease? Imagine learning you have tuberculosis and wondering if a vaccine could help. It's a common question, but the answer is clear and important for your health. If you have active tuberculosis, getting vaccinated with the Bacille Calmette-Guérin vaccine is not recommended. The reason is simple. The vaccine is designed to prevent infection or reduce disease severity in people who do not yet have active TB. It does not treat or cure active disease. When someone has active tuberculosis, their body is already fighting the bacteria, and antibiotics are the standard treatment. These medications, usually taken for 6 months or longer, are essential to kill the bacteria and stop the disease from spreading. Vaccinating during active disease does not help and could interfere with the treatment process. The main goal in managing active TB is to diagnose early and start the right antibiotics promptly. This helps prevent complications and transmission to others. Vaccination is mainly used as a preventive tool in high-risk populations, such as infants in countries with high TB rates or healthcare workers in contact with TB patients. But it is not a substitute for medical treatment once the disease is active. The BCG vaccine is most effective at preventing severe forms of TB in children, like TB meningitis and miliary TB. However, it offers limited protection against the most common form in adults, which is pulmonary TB. It does not prevent infection with TB bacteria or the progression from latent infection to active disease in all cases. The vaccine is generally safe, with mild side effects like swelling or pain at the injection site. Serious side effects are rare but can happen, especially in people with weakened immune systems such as those with HIV. For individuals with active TB, vaccination is not part of the treatment plan. Instead, focus on completing the full course of antibiotics prescribed by your healthcare provider. If you suspect you have active TB or have been diagnosed, always follow your healthcare provider's advice. They will guide you through the treatment process and help prevent spreading the disease. Vaccination decisions are based on individual risk factors and local public health guidelines. In the future, researchers are working on developing new TB vaccines that could provide better protection, especially against lung disease in adults. But for now, the best approach is early diagnosis, complete treatment, and targeted vaccination for those at high risk before infection occurs. To sum up, if you have active TB disease, you should not get the BCG vaccine. Your priority should be to follow your doctor's instructions and complete your antibiotic treatment. Vaccination is a valuable tool for prevention, but it is not a treatment for active infection. Always consult healthcare professionals for personalized advice, especially if you have symptoms or have been exposed to TB. Proper medical care and public health measures work together to control and eventually eliminate tuberculosis.